No medicine can remove the cause of a lifestyle disease, but you can.
One of the recent patients I can tell you, that is actually a very severe form of erythroderma type of psoriasis, and almost the 90% of the body was affected. We all know that generally the psoriasis is incurable and you had to take applications of the on the skin, and also if in severe cases you had to take it. So you had to find out the reason for this overactive immune system. Our immune system is actually supposed to be protective, but it is destroying our body. Basically, it is an autoimmune disease. But it can affect the other organs also. That is the importance of an autoimmune disease or the significance. Here in autoimmune disease, what is happening is some changes in the cell, especially our body is made of food. There are many medicines, many of the antihypertensive medicines and anti-malarial medicines. And there is a long list of medications which can give drug-induced psoriasis also. What is needed for a lifestyle correction is the nutrition should be optimal.
Welcome to Lifestyle Disease Doctor. Today we begin a 4-part series on a disease that affects millions around us. The disease is psoriasis, and in the first episode we will be looking at what are the causes, the underlying reasons behind psoriasis, and what exactly is psoriasis. To begin with, the first question to Dr. Jolie is, what is psoriasis?
Psoriasis is an autoimmune disease primarily affecting the skin, and it will create different type of lesions on the skin, and according to the type of lesion we call it as exfoliative or scaly psoriasis or gutted psoriasis, pustular psoriasis, etc. Basically, it is an autoimmune disease. But it can affect the other organs also. That is the importance of an autoimmune disease or the significance. It can affect the nails and also the joints. That is the most common. But I had seen patients with affecting the psoriasis, which is affecting the eyes also, with corneal ulceration and uveitis, etc. So basically, it is not only a skin disease, but it is a systemic disease also.
Lifestyle plays a big part in psoriasis. Can you explain on that?
Yes, definitely. Psoriasis is a lifestyle disease primarily. But almost all the lifestyle diseases has an entity of genetic factor also, just like diabetes. Diabetes is a lifestyle disease, but there is a predisposing genetic factor can be behind that. Just like that, psoriasis also is primarily a lifestyle disease. But basically, what we should understand from that is, if at all your mother is having, or one of your siblings or someone is having psoriasis, then definitely the chance will be high to affect you. And the study shows that around 30% of the twins can have the same. If one is having, that is 30% chance to develop for the other twin also. But you can, one should do. The positive thing is, the genetic factor you won't be able to control. But the epigenetic factors, the environmental factors, that is more important than the genetics in the diseases like psoriasis and all. That you can make a lot of difference by the lifestyle correction. That is, environmental factors means lifestyle. So if you correct the lifestyle, definitely you can make the disease away more. It's really in a great extent.
How does the immune system get involved? What is the connection between the skin and immunity?
See, basically, we should understand that skin is a part of the immune system itself. So, immune system means protecting our body from the external part. It is the protective wall of that. It is actually the boundary of our body. And we are considering skin is the boundary of our body, basically, physically, when we are talking about. So, when the autoimmune disease means your immune system doesn't know which is your part, your cells, or that is a foreign body. So, for example, when a bacteria is or virus is affecting you, the immune system, they think it is a foreign body and try to remove that. Here in autoimmune disease, what is happening is some changes in the cell, especially our body is made of food. Basically, it is only food. So if some of the food is, or in the air factors, the air or the food is not polluted, or it is not, or you have any tolerance problem, then the immune system thinks that the cells made of that particular cell is foreign to the immune system, and they start attacking. Here in this skin itself, as the skin cells is attacked by the immune cells, especially these neutrophils and T lymphocytes and killer cells and so many things. And they just in the microscope in the of the psoriatic skin, it can see, the doctors can see, the pathologists can see that there is an influx of this immune cells into that, and this secretes certain leukotrienes and IL-6 or 25 or so many different names are there for that. So many cellular mediators are released, and this is actually creating faster turnover of the cell. Usually the skin cells, this basal cells to this epidermal, this superficial cells, the corner cells will take 28 to 30 days. But here in 4 to 5 days, the cell turnover is happening. So that is why the reason this flaking and the cell is usually the 30-day life expectancy, but it is life expectancy is reduced to 4 days or 5 days. That is what is happening.
Is there a connection between gut health and psoriasis?
Yes, definitely. This gut health means gut is also the internal covering. Actually, we have an internal living system inside our body. So the gut having so many bacteria and viruses and so many undigested food, we can say that skin is comparative. There are also bacteria and so many other living organisms on the skin. But in the gut, it is much more. And most of the psoriasis patients who is having affection in the skin may be having some internal problems also. There are very common that psoriatic patients having mouth ulcers and all. It means that it is not only the mouth ulcers, your intestine also part of the mouth actually up to the anus. There can be ulcers, and the undigested food and bacteria can get into the body also. That may be one of the trigger mechanism for the our immune system to overreact. So it is clearly, studies also shows that the psoriasis can flare up after a tonsillitis or a streptococcal infection or a staphylococcal infection. It can flare up, but it is very known to the medical world.
Actually, when we talk about psoriasis, the issue, often the patients don't realize that it is the beginning of psoriasis. They may think it is some other sort of allergy or some infection and all that. So, what exactly can a patient do to get an early diagnosis so that they can treat better?
Usually, it's a skin infection or skin manifestation. It's not an infection actually. It is a manifestation of a internal problem for the immune system actually. This skin manifestation. Small things we just ignore it. That is our nature. That is, if you are trying to avoid it, and if it is after you can see that after viral infection and all, there can be skin peeling and redness, and it all comes, and it may go after that. But if it is persisting, then we should be serious about it and think that it can be an autoimmune manifestation or autoimmune disease. And there are many other autoimmune diseases which has skin manifestation also. So whatever is the problem, if it's just a skin disease only or some other manifestation of other internal organ involvement also, we should take care. And another more early sign is the scaling and this what we call is dandruff. And some dandruff and all, we agree with that, and some hair treatment or this parlor treatment and all this. But if you are getting recurrent or severe this flaking of the scalp skin also, you should think that it can be an early state of the psoriasis. And also the skin problems, and it can be other things also can be associated with that.
Actually, what are the common triggers, because sometimes psoriasis suddenly flares up. So what are the common triggers that do that?
Usually the triggers, it can be a stress. If you are facing a problem in the life, you can get if a person is prone for that or genetically predisposed to stress can lead to a flare-up. And also certain food. And last day, actually, one of the patients is telling that I had psoriasis and I was managing it with it. But during the last festival season, that is Easter. He's a Christian, and the Easter, I had had a travel, and the food control is completely gone. Now he's a severe flare-up. So that can also happen. And also the change in the climate. And basically, most important thing, what I understand is from my patient's experience, is the food and the stress. And even if you are giving proper protection for the skin, for the whole climate or something like that, then you can even manage that easily. But most the stress and this food management is the most important, actually.
Say, if it is so, if we can identify the triggers, and that is basically what is causing it as root causes, can we reverse these causes and then get freedom from psoriasis?
Yes, that is what that I am. My way of treatment itself is that, actually. We all know that generally the psoriasis is incurable, and you had to take applications of the on the skin, and also if in severe cases you had to take internal medicine that is mainly of antimetabolite or steroid type of medication, or even immunotherapy. That is a severe cases we give that sort of medications, especially that are treated by usually the rheumatologist or a skin expert will be giving. My expertise is actually on managing it with the clinically supported lifestyle correction. In that, basically, I had seen in severe forms like this erythroderma type of, that is a red skin with severe flaking of skin, and also all sort of fistula, cutate, all sort of psoriatic patients, and also with psoriatic arthritis and the nail affection. Everything I had actually I have exposed to and I had treated. And basically, if you are able to find out what is the triggering food actually, and then they avoid that. And also, actually, the stress, all the psoriatic patients will be stressed also. But once they are able to get a relief, their stress also will be reduced. So what I say is, it's a very, actually, with medicine, it is very difficult to treat it. Immediately, if you start steroids and all, there will be benefit. Or if you are the latest immunotherapy, you may be getting. But after that, it will be actually suppressing or manipulating the immune system. So the disease the skin manifestations will reduce, but you may get a thyroiditis or the hepatitis, or see, if it is methotrexate and all is using, that is the very commonly used medicine. If it's a long-term use, not even long-term use, I have seen within 1 or 2 years, the eyes can be get affected in some people. It's not for everyone. So the permanent immediate flare-up, you can use it. If you are severe flare-up and all, then we had to use this immunosuppression syndrome, but not for a long-term management. You can suppress it, then shift over to the lifestyle correction and come out of the medication itself. That is the ideal way to, and find you should understand, basically you should understand your body and the body's language. Actually, all these symptoms is the language of the body to show you that the problem is there. So understand that, find out the problem in the lifestyle, and avoid that, and then you will be able to manage it very well.
And that gives a lot of encouragement to those who are suffering. Can you give an example of how this has happened for an individual?
Yes, I have. So I had treated many psoriatic patients. I can tell you one of the recent patients I can tell you, that is actually a very severe form of erythroderma type of psoriasis, and almost the 90% of the body was affected. He was staying abroad actually. So he came, he was looking for all the solutions. He had taken some treatment, but it is very severe exacerbation actually. So he found out from some searching the videos and found out this, and they studied the whole website and many videos, and then he came down to Cochin actually. Actually, in that stage, he was almost the 90% of the skin, and the skin is looking red and severe exfoliation also. He showed me a photo of the one day morning, how much scales of the skin he has collected also. It's a huge amount actually, it's a bunch. And this person Actually, he doesn't want to go to home also because he doesn't, the children, wife and children will be afraid. Luckily, his face and this hand was not much affected. The internally, because he's wearing many of the psoriatic patients are wearing a full sleeve shirt and full this thing, so that if the face is and the hand is not affected, no one will know about it. So he was managing like that. So actually started the treatment. Next day itself, he is having a relief actually. That exfoliation is reduced. And that is actually what we are doing is finding immediately the result has to come for the test and all, which food is correct, which food is not comfortable for him or not reacting and all. It will take for a few days to get the whole the report. Actually, we do a very detailed analysis of the whole body and also about the food and details. So, but we cannot wait for that for the patient who is suffering. So we start the treatment, and special minimal number of ingredient food will be advised and is actually given, and with all the nutrition for the skin to repair. Actually, for the body need to repair, all this damaged cell has to go and it has to get repaired. And within 1 or 2 days itself, he is comfortable, and he has psoriatic arthritis also. Joints were very edematous. Many of the, especially the knee joint was very edematous, and the whole joint also was affected. But within few days, he is able to be in a comfortable position, and within 30 days, because the turnover time is 30 days. Now it will take a minimum of 30 days for a reasonable improvement, because but by the 30 days itself, many of these lesions was gone. Actually, this redness and all was come down to almost 60-90% reduction was there. Now, some part it was 90%, some part it was slightly less, and it was by the actually after 1 month he was gone back to his working place, that is overseas actually, and after 60 days he sent the we always ask for sending the skin problems photos and videos of the especially the photo of the affected part. So it was almost clear after this applying special nutritional oil is given for supporting protecting the skin, and after applying the having a bath and applying the skin is perfectly all right. And in the morning, we always ask for the night after bath, and then the morning, because after 8 hours or 9 hours, no skin application with this. This only nutritional, mainly nutritional based actually. It's not there. Then slight powdery scales are there. That's all.
See, if you would like to give a message to every patient, psoriatic patient who has just discovered he has got psoriasis, or patients who have been treating their psoriasis for long, but they are not satisfied with the results, what is the message that you will give them?
Yes, basically, I have seen, as I said, all the sort of different patients, and many will be, usually my patients will be diagnosed early and they were on medication. Unlike this methotrexate and heavy MMF, and even they might have, many of them have tried already this latest monoclonal antibodies. Like, I don't want to make the naming of this medication is very difficult, because everything will be nib, or so it will be ending like that. Basically this immunomodulators and all sort of medicines they may be taking. They may be taking from 2 or 3 group, and also definitely steroids and local applicants. They may be in a milder form. The severe form can be reduced to a mild form. They usually, most of the patients is not getting a full relief, or they will be having arthritis and the nails will be affected, or they will be very tired and tiredness will be there. So that different way. So my message is actually, this medication is not the answer for the psoriasis. It is a lifestyle disease because of the immune overactivity. So you had to find out the reason for this overactive immune system. Our immune system is actually supposed to be protective, but it is destroying your body, your cells, skin cells, and joints, or any other part of the body. So we had to, basically understand it's a lifestyle disease, and the environmental factors, correcting the environmental factors, optimal nutrition, optimal exercise, or optimal activity, mental and physical, not only the physical, mental and physical activity, and avoiding the toxins. Toxins can be the cosmetics you are applying, and also the food additives you are using, even the food itself. Some people, we know that gluten uh, sensitivity. Just like that, there is other food also. Different people can be different ways sensitive to different food. We had to find out that now there is methods to find out that. That is the most important thing. And you should learn how to live with and how to take food to not flare up or to keep your skin protected. So in that way, you can manage. There's no problem, and you don't have to go for this immunosuppressants, steroids, or anything for a lifelong treatment is not needed. Only to learn how to manage and what is your problem, which food is creating, or what lifestyle factors it is affecting, and find out that and live and make according to the changes it is possible for you.
What are the current options of treatment for psoriasis?
See, basically, the first any disease, lifestyle disease, first line of management is lifestyle, but that has to be done by the patient. When you are for any disease, when you are going to the doctor, will be you are asking for the medication. So in the psoriasis treatment, the medications can be locally applying medications for reducing the itching and scaling and all, and also the oral medications. Oral medications mainly initially there was only steroids, and now there are so many immunosuppressants and immunomodulators like this. Monoclonal antibodies are available, injections, weekly injection, monthly injection, and that way it is there. And also this anti-cancerous medicine, almost all these immunomodulators also, that is for the immunotherapy in cancer, it's the same medications, which is, many of them are the same medications which is used. And also the anti-cancerous medications like methotrexate, that is anti-metabolite, and also cyclosporine, and many medicines like that is used nowadays. And this next is this PUA therapy, that is it is given for the generally it started with the vitiligo, this hypopigmentation of the skin, and the same ultraviolet rays or the PUA therapy. In PUA therapy, we are using the sunlight's ultra violet rays, or else artificial lighting with the high ultraviolet rays, and along with that some medications which will be taken applied on the skin, or also taken orally also, psoralen and such things. That is PUA therapy. And these are the different options that, and also previously the Coltar and all is used, but nowadays I don't think better medications are there. This even the Coltar is having some cancerogenic properties. So, but any of this increasing the ultraviolet rays, PUA therapy, that also actually having damage and the cancer possibilities is that is a problem actually. Basically, anything which is applied can be create problem also, even the injectable and the latest injections also, even one of the main monoclonal antibody which is used for the psoriasis, it can actually flare up also. Initially it can the suppression may be there. In some patients it can make a flare up, and in this, as I said, it can be used for other things also. I said, no, like if it is using for rheumatoid arthritis, it can make a flare up reaction for flare up or a skin reaction as a psoriasis. It can start itself. And also many of things, this are thyroiditis. It is very common when you are using such immunomodulators and immunotherapy, that sort of problems also can occur.
As you said, most patients are worried about this long-term use of drugs because they understand that it's like they have to take chronic drugs for a long time. So they are worried about the risk. What is it that we can tell them?
See, every medicine has its own risk also. I don't think there is any medicine which has no side effects. We had to weigh accordingly. That is what is best. Even the most common paracetamol we are using for the pain and fever, that also has side effects. And even it can, in the last doses, it's mainly the liver can be affected, because almost any medicine can have everything is going into the liver, so liver can get affected. Even the methotrexate is very commonly used for the psoriasis patients. It is actually what they are doing. Actually, it is doing the suppressing your bone marrow, your immune system itself, bone marrow Yeah, there are the WBCs and all the, not only the WBCs, RBCs and WBCs and platelets, everything is made there. So long-term use of it can go to this bone marrow depression. That is why if the methotrexate is using, you have to check uh, the blood count every week or at least every month. So if it is going down, you have to stop the medicine. And also you have to check for the liver function test. If the liver function test is going up, then this SGOT, STPT going up, you have to stop that medication. So any patient who is using this medication for the psoriatic medications like methotrexate or whatever medication, they should frequently check for the CBC, that is blood cell count, and also this liver function test, and definitely the kidney function test also. In kidney function test, you should ask for the GFR, that is glomerular filtration rate, that is the earliest to reduce, and also microalbuminuria, albumin loss in the urine or RBCs in the urine, or this GFR test if it is abnormal, then you have to either the medication is affecting you or the disease itself is affecting that organs also. So we should be very careful whoever is taking medication. And it is always, when you are in a stable situation, you can come out of, by lifestyle correction, you can come out of all the medicines. That is, I'm telling you, it's not just a theory alone. It is actually basically in theory, if you look in the medical literature, there may not be anything like that what I am telling. This is it's a lifestyle modulation sort of, because everywhere we are thinking about the medications only, the newer and newer medications only. No one is making any study or research into the how the food can, or the changes in the food can affect each and every disease. That is why we are not able to get such a support also. Everyone is, the modern medicine is, or any other medicine situation is the same. We are looking into the medication. So actually your problem is your lifestyle and your body, your food. Your body is basically made of food. So you should, if you look into the problems with that, you can definitely come out of medications, get stable with the medicines, and then come out of medication also, and find out what is the correct way of correct lifestyle for your body. That is very important. It is each person, it will be different also.
Actually, in the world around us, we see that lot of these natural healing mechanisms and creams and all that are heard of in plenty. So, how do psoriatic patients, in what way should they approach such options?
Definitely, natural way of healing has major role in that healing of, not only for the psoriasis, for every disease. See, in Mao, where I am residing in Kerala, it's Ayurveda treatment is very famous for all ailments. That is the traditional Indian medicine. So there are so many solutions are there, and what I see is I have experienced the patients who have gone through all these treatments I had met actually as a patient. The problem is when they are staying in the hospital, the Ayurveda, usually they'll be staying in the hospital for 21 days, 28 days, 41 days, and such treatments are there, then it will subside. And when they come out of the hospital and start their normal life, it just slowly started coming up. That is the problem. So that is why, in my approach, what actually I'm teaching, actually it is not just a treatment, it is a teaching program. And understand their body, not only I have to understand, the patient has to understand their body. And making them, enable them, actually our aim is to enable them to understand the body and to live according to the limitations or positiveness of their body, and adjust the lifestyle accordingly. In that way, it is very easy to manage. Not with none of the medicines. I know all this because I am a modern medicine doctor. I am treating these patients. I know that what are the possibility of the medicine, and even though I am giving in the initial stage flare-up light medications, definitely I also use. But within a month, I will be able to come out of that. Then after when the patient the human, it is nature, no? So they may get into some trouble, mental stress or travel, and then they will teach the patient to how to use medicines judiciously for a short time. If they get not a flare up, it's a mild symptom. If it is developing, then they have to cut short with that itself. Well, you should understand that with a mild itching in the skin, the leg or the ear, so different people will be different sites of exacerbation, and in the starting itself, control it. You are going out of the way from the you are deviating from the lifestyle, and control it, and take some light medications for just to stop the itching or the problem, and don't allow for a flare up.
Actually, how can or when can a patient decide that if they are undergoing this normal conventional treatment of medications and creams and all that, when can they decide that they should look at correcting their lifestyle also?
See, if you are need any medication for more than a week, then you should think what may be the reason. And your medicine you are using for a skin problem, you are using a medicine, and it is going, and after some time it is coming again, and it's going and coming after the medication is stopped. That means there is a problem internally. Your immune system, whatever is the disease, your immune system is the protective, not only the skin, every aspect. That the immune system or the metabolism. Your metabolism is also controlled by the immune system. So your metabolism or the immune system is out of balance actually. So you have to take it back to normality. So how you can do it? It is you cannot correct the immune system with the medication. You can suppress the immune system with the medication. You can, with vaccination, you can give a protection or the stimulate for a particular infection. Or with the antibiotic, you can suppress this or kill this bacteria or virus, or the growth can be suppressed. But you cannot balance the immune system with medicines. You can support the immune system with the medication, but long term, immediate use, you can use all these measures, whatever is available, and then find out, give time and find out, understand, and come out of it, and correct your lifestyle, then come out of it. Then they learn how to live with your limitations. The disease is a limitation for the patient, that's all. So if you want to understand that the lifestyle limitations, you will be able to come out of it.
Actually, for these latest treatments, we hear these biologics and all that. So those who are thinking or planning for that, what is it that such patients should know about?
Biologics actually in the third level medicines. Actually, the first level of medication is this applying on the steroids and the coal tar and such things. Next is the PUA therapy and this ultrasound, this ultraviolet rays therapy. And the third level of treatment is the methotrexate, high-level immunosuppressants like cyclophosphamide or this anti-protein inhibitors sort of things are there, and also the monoclonal antibodies, that is actually as an injection. And they'll be costly also. But many of the nowadays in many of the places the treatment is fully this insurance covered. In such cases, the cost may not be a factor for many of the patients, but we should understand that the cost may not be a factor, but your these monoclonal antibodies and all these immunosuppressants are making your modulating or different ways your immune system will be affected. You may get a relief in the skin, but after within 3 or 6 or 7 months, you may get a thyroiditis or other systems start affecting. So that is the problem. So whatever is what you have to do is get yourself comfortable with the medication. You definitely, for psoriasis patients, the medication is effective. Within 2-3 weeks, there will be definite relief will be there. And after that, you concentrate on your lifestyle, but you may not be able to do it yourself. That is the problem. And there are not many doctors who is available for the treatment also. I don't know anything like what I am giving, this clinically sort of support, this coming out of this lifestyle disease with clinical support. I don't think that there is anyone. I don't know exactly, but in my premises or anywhere, I have not seen in the website or anything, or the internet or anything, This sort of approach I had never seen. Actually, one of my patient last day, they're calling from one of the Western countries like Canada or US, and he was asking me, he has to come over here, or whether I can give advice. I can give advice, but it is not sufficient actually. A person, if you want to take a clinically supported lifestyle correction with what I am doing is at the cellular level. We call it as a cell activation protocol. It's a protocol actually. It has to learn initially. So you cannot teach them by the digitally by this method. They have to come and first you have to work out. And he is also asking me. I am asking the doctors here and asking for this test, this allergy test, and to find out my ideal food. They are not allowing me to do it. Actually, he's telling. So that is because it is not commonly accepted in the modern medical practice. Also, the psoriasis or any other autoimmune disease. If you are want to look into the food and lifestyle, generally there will be a saying that you have to take regular exercise and get good sleep and avoid this alcohol, smoking, and such things. There always every major hospital website or the NIH websites will be advising that. But never in a specific form of looking into for the allergy, there will be allergy tests will be there. But this should be had to go into not only the allergy oriented, intolerance and other available tests also. When it is available tests are there, then it will be easy to find out which is. Otherwise, we had to every items we had to take it and see whether it is and then avoid it. That's when I started practicing this clinically supported lifestyle correction. Only this allergy test or IgE mediated test were available. Now even the other mediation like IgG mediated tests and all is available. That is giving more convenience actually. Before also we were able to manage the patient, but it will be more easier for more of this knowledge oriented test along about the food and the environmental factors available. It is easy to support the patient actually.
You were mentioning that there are different levels of treating psoriasis in the conventional treatment approach, and in the third level is what these biologicals and all come. So, if a patient who is taking such biologicals, in your experience, can those patients also benefit from lifestyle correction? And,
yes, definitely. Most of my patients are already on this methotrexate, and they may not be. Usually, the first line of oral medicines will be steroids, like a prednisolone and all. Defac, here I've seen prescription like Defac or prednisolone. And next is will be methotrexate. And next, this tofastinib sort of medicines will be there. That is that is also this immunomodulator group of medicine. And next will be this monoclonal antibodies. That the names are very difficult, so I don't want to pronounce it. So all sort of patients I'm seeing, and all of them can come out of medications within in a month. Most of them, if less medicines, within a month. And methotrexate, and I have seen patients with the 15 milligram, 20 milligram. It's a small tablet every week only they're taking. So it's very cheap, it's very economical medication. So no one will be thinking about it's too hard about that. It's a simple thing, you can take it. But actually, if you're taking such medicines, you should, as one thing, you had to check at least every month, you had to check your blood, the blood count, and also the liver function test, and also the kidney function test. If anything is going abnormal also, you have to be careful, and it is time to stop. That is, it can create problem. So you cannot simply stop the medication for the psoriasis. Even the steroids, if you stop at a moment, it can give a flare-up reaction actually. So never stop the medications just because it is having side effect. Just if you follow I cannot say that you can go to. So usually the modern medical doctors are this skin specialist or the rheumatologist. What I'm saying is here it is usually the rheumatologist will be giving this sort of medication that the patient in our part of the country. This sort of things are usually treated by the rheumatologist, and the specialized prescription like this monoclonal antibodies are given by the rheumatologist. So those who are come to me and that following, and they are all able to come out of the medication, and they were able to manage the smile. If it is when everything is over, this skin lesions are over, then you can follow this diet also. When they are adjusted with the diet, that is possible within 3 months for almost all the patients. Only if they neglect their lifestyle completely and they support the skin applications, it's all in the nutritional based actually. If they completely ignore that, then they can get a don't go for a flare up and all. If the modern medicines like steroids are started, immediately there can within weeks you can get a flare up also. So there is a method to here also. We'll be withdrawing the medicines one by one, and in a time period, and following with the symptomatic relief and also blood reports also. With the blood report improving and the symptomatic improving, each medicine is reducing the dose and then finally come out of it. That within how much time it can be out of the medicines depends on how much medicine they are using. So within 3 months, I had seen almost everyone, and many of them will be out of the medicine within a month itself.
Actually, if you have to give a message to patients who are frustrated with treatment and frustrated with their psoriasis and the treatment, and who are worried about continuing on more and more serious medication, what will be your message?
Basically, what the patients should understand that it is a lifestyle disease. No medicine or injection or surgery or anything like that can't cure a lifestyle disease. That is what happened in the psoriasis treatment also. We are going for more and more medicines, and all the medicines will be having, all the medicines which is used for the psoriatic treatment is immunomodulators or some way or other way immunosuppressants, because it is an autoimmune disease. It's an overactivity of the immune system. So trying to suppress it. But that is not an answer. So if you look into the best hospital or anywhere in the world, like Mayo Clinic or wherever you are looking also, this sort of medications, this step-upping type of medication will be there. Like this local applicant, then PUA therapy and all, that the last grade will be the metabolite, anti-metabolite, methotrexate, and this immunological therapy. So that is the last, because they are having that, that also will be definitely written in that it is the more side effects can occur. Don't think that if the latest treatment will be having more costly, but it also it doesn't mean that the costly medicine doesn't mean that the side effect is less, because the latest medicines will be the costlier, and the research also, or the experience with the treating with the medication also may not be sufficient. There are so many medicines which will be coming for 1 or 2 years in the market, then that is banned and or withdrawn from the market, and it is all common. That is because withdrawn from the market means there is so much of unacceptable side effects. That is the reason. So understand that you can come out of this medication, and that is the positive thing. You should understand that you understand how to correct the lifestyle. It's a lifestyle disease. Only thing you have to understand how to correct it. For that, you may need support, and how you get the support and how can you arrange the support, that is the matter actually.
Most people think that psoriasis is a skin condition. What exactly is psoriasis?
See, psoriasis is basically an immune system disorder. Basically, you should understand that. It's a manifestation of the immune system imbalance. There is an overactivity of the inflammatory part of the immune system. Actually, immune system has two wings or two parts or two sections, which you can say. So one is inflammation, that is the defense, protecting the body. Next is healing, that is repair of the body, repair at a cellular level, and rebuilding the body or the organ. That is the thing. So here the inflammation, almost all the lifestyle diseases are considered as inflammatory disorders. The inflammation is high. Why the inflammation is high? We know that the infections, we know that there is a clear-cut reason for it. If the COVID comes, there is also inflammation is high. And we know that the virus is the creative problem. For all the infectious disease, we know this biological agents like virus, bacteria are creating the problem for inflammation. So in this type of autoimmune disease, what is happening is these toxins, it can be a part of the viral or bacterial infection also. Many of the autoimmune diseases occur after this. Even the psoriasis occurs, many of the cases. Not for everything, there will not be any evident pre-infective state. But it is very clear that the studies also show that the streptococcal infection of the tonsils or the skin, this sebaceous glands or something. After that, this flaring up of the skin psoriatic problem can occur. So basically understand that it is an autoimmune, your immune system is acting against your cells. There is a reason, and there will be most probably toxins, and it can be of any type of the toxins, and that we have to find out.
Actually, most of the psoriasis patients have other comorbidities. What are the major common comorbidities that are associated with psoriasis?
Common comorbidities means basically this progression of the disease can be the other autoimmune diseases like arthritis, uveitis, corneal ulcerations, or the liver problems. And other thing is, these problems can occur because of as a side effect of the medication, long-term medication. We know that steroids, if you are taking steroids, you can develop obesity and also diabetes. And if you are getting a diabetes medication gets started, you can get all the other metabolic syndrome like hypertension, heart disease, atherosclerosis, cholesterol high. So any psoriatic patients who is on long-term medication, psoriatic patients will be definitely on some medications because they are suffering. They will look for medications definitely. And they will be having other diseases. If you look into that, definitely most of them will be obesity, at least overweight, excess fat will be there. When we look into the ultrasound scan, the fatty liver will be very good amount of patients will be having fatty liver, maybe 70, 90, 80, 90% will be having fatty liver. And if you look into the liver function test or the kidney function test, there can be also kidney problems will be there. If you are looking to the blood test, there will be most of them will be pre-diabetic. Even the HbA1c, sugar may not be high, but their HbA1c or at least the insulin level will be high. And I have seen the patients, their HbA1c and the sugar is high, okay, but the insulin level will be high. That means it is a type 2 diabetes, pre-diabetic stage, and insulin resistance is already started. And cholesterol will be, or at least the triglycerides will be high. So many problems, almost all the disease can accompany with, especially those who are suffering for many years. They'll be having not only the psoriasis, all these other common diseases like diabetes, hypertension, heart disease, all will be associated with it.
Actually, you were telling that many comorbidities are usually associated in psoriatic patients. Now, those psoriatic patients will then definitely be having to take many medications to deal with their different issues. So how can a psoriatic patient do us to deal with these sort of multiple medications? How can he, what should he understand about this sort of multiple medication treatment?
See, psoriasis, this medication itself can create a trigger for the psoriasis actually. There are many medicines, like many of the antihypertensive medicines and anti-malarial medicines, and there is a long list of medications which can give drug-induced psoriasis also. So if you are taking a medicine and if you are getting a psoriatic sort of lesion while you are on a medication, then definitely take it as a sign of that it can be because of the medication itself. Because when you have a disease, your immune system is under stress. All these diseases we are categorizing in the lifestyle diseases, like this diabetes, hypertension, this metabolic syndrome group, and also allergies, asthma, and also this cancer. All these diseases, when the disease is there, your immune system is under stress. Inflammation is high. And all the psoriatic patients, either these inflammatory markers like CRP, HSCRP, ESR, etc. will be at least some of it. It depends on the patient. Some patients show some of these inflammatory markers high. So that means inflammation is there. That is the primary, the body's immune system is producing excess inflammation. That defense part of the body is overactive. And you have to balance the immune system, that's healing and inflammation and anti-inflammation. The defense and healing has to be balanced. Then only you can come out of this disease. And also, if you are basically almost all the medication for the psoriasis is immunosuppressants. So just suppressing the immune system will not give you, it is not the correct way. The immune system is overactive because there is a toxin. If it is, it can be in the form of a biological agent like a bacteria, virus, or some other chemicals, which is not suitable for you. So one chemical which may be okay for one person may not be suitable for you. So you have to find out and distinguish that and avoid that. And also you should give enough nutrients. Your body is basically made of nutrients, food. So you should be given, the body has to be given for the repair, for the if the repair activity has to take place in the proper way, you need almost 57 nutrients. The one is oxygen and the next is water, most important. Then other 55 items are there. 14 vitamins, 14 minerals, and around 20 amino acids and 4 fatty acids, especially that omega-3 fat and omega-6 fat. Actually, they are the controllers. The immune system is controlled by omega-3 fat and omega-6 fat. Omega-6 fat is controlling the inflammatory part, and the omega-3 is controlling the anti-inflammatory part. In our modern diet, the problem is the omega-6 is so high, very high, and omega-3 is very low, and it's almost many of this is very trace only. So actually this high omega-6 inflammatory fat and low omega-3 anti-inflammatory fat is actually giving an imbalance to the immune system and triggering all these diseases, not only the psoriasis, other diseases also.
Actually, you were mentioning about stress. So what is the role of stress and sleep in psoriatic patients?
See, stress can give a flare-up, and stress will give sleep problem also. When your flare-up is there, you will be having, psoriatic patients will be having itching and so much trouble. They will not be, because of the itching, they will not be able to sleep. I remember one patient, she is telling me, "Doctor, I have not slept for many days because I am not able to sleep because of the itching." So will be in such patients, severe itching, it is very common, but it is some patients the itching will be very severe. So most of the patients, psoriatic patients with a severe disease, they will be having this sleep will be affected, and they will be, because of the stress itself. The stress can bring the disease, and also the disease can increase the stress and the sleepless night, and it will again flare up. So that is the situation. But if you have correct approach is there, within a day, I remember that that lady, she wanted to, usually we investigate the first day, and then next day only we maximum. The earliest means the next day. Because of her difficult situation, we started her treatment in the first visit itself, because she was in that much trouble. And next day, again, in such cases, we ask for them to come on the next day also. So for that only the partially we'll start, and then next day also. That lady came the next day, and did you sleep? Had a good sleep? She said that for many days I slept. That is comfortably. So that is the result actually. If you give your body the correct nutrition and the skin the correct support, and definitely the sleep medication, actually I don't give this induces actually, that sleep rhythm correction, like that is also natural. The melatonin, that is actually the sleep, the one hormone is there for the sleep. And along with that, the lifestyle correction also. Lifestyle in the sleep habit also has to be developed. And if you are looking on the computer and going to sleep at the 2 o'clock, and such things also create a problem. If you are in a trouble, you should go according to nature's rhythm also. The sleeping in the night and no light, that is actually the melatonin will come out only if you put off the light. If you are sitting in the middle of the night, bulbs and all, or looking in the computer screen or the TV screen, you will not get the sleep, and the melatonin will not come. You have to adjust the natural rhythms, or you had to adjust with that also. You should understand it, correct it, and then it is easy to come out of these problems.
What is it that you can say, because some psoriatic patients, they find it difficult emotionally and mentally also to manage psoriasis. So what is it that, what is it that can help them to overcome their mental stress?
Yes. See, first is, to any disease, if you want to overcome, first you should understand the disease itself. And then you have to say, psoriasis, the disease is an autoimmune disease. It is, your immune system is under stress. And why your immune system is under stress? Because there is excess toxin in your body. The excess, which is the toxin actually, what toxins? We should understand that the air pollution is there. Our food is totally polluted. and so much of pesticide residue is there, so much of this water. So in many things you may not be having much control over it. That air, you don't have much control, but you can avoid this perfumes and the stress itself. You can take care this as much as possible. You use natural cotton dress, preferably white dress, because the chemicals will be less on that, and wash it with many rinsing of the, if you will be using detergents, and see that at least 3 or 4 times. If you are sick, if you are suffering from like psoriasis, you should rinse it at least 4 times, and so that all the detergent residues will be gone. And such things to reduce the toxin, and also this color and preservatives in the food. You use the fresh food only, and also we are taking so in the modern world. You will be eating. I am sitting in Cochin, Kerala, and the southern part of the India, but I am getting all the foods from the New Zealand or the China or America or the Europe. So, and it is in the fresh fruit form or in the dry fruit form, or so many things which is made in the different part of the world, and we don't know the ingredients. We don't know what is actually applied on the things. Even it is looking fresh. It will be looking fresh, but it will not be fresh, and many things may be applied on it, and it is all you are taking it in that form. So human is supposed to live with the food which is made around in maybe within 10 or 20 kilometers, but we are getting it from all over the world, and it is preserved, so much of preservatives. There are more than 10,000 this generally approved chemicals which can be added into the food. So that is it doesn't mean that it is approved preservative. It doesn't mean it is safe for you. And imagine what all things actually we are eating, and you had to understand that first. What is the reason for disease, and what is your body is made of just food alone, and what are the food you are ingesting, and what is harming you. If you get an understanding that, and if you are willing for the correction, and if you get proper support, because everyone, the profession, the expertise is needed. Expertise means modern medicine or any medicine. That you should understand that also the modern medicine or the latest medicines you are looking at, you will only get the medicines listed. You will not get the understanding about the lifestyle correction, which can be give a relief for you. So you should look for that specifically, and try to get support for that.
Actually, when patients who are on immunosuppressants or biologics or other having serious other complications and comorbidities, when they come for treatment for psoriasis, when you're looking at it from a lifestyle correction perspective, how can we, what is it that they can expect?
Basically, in my approach, that is clinically supported lifestyle correction with a cell activation protocol. This is based on a protocol which is made with a very long exposure to such diseases and treating such diseases. And not only the psoriasis, it is made for any lifestyle disease actually. The psoriatic patients also will be having diabetes, hypertension, heart disease, and arthritis, and different problems will be there. And actually, this is a single solution for all these diseases actually. So what is actually, you're doing the lifestyle correction with the protocol. So that is why I am able to manage different diseases at a time, and also different type of people. One person may be having for a heart problem, they ask for a bypass surgery. The other person, the same day we are starting treatment for one for the psoriasis, or one for psoriasis plus arthritis, and one person may be having some other disease like this osteoarthritis with obesity and osteoarthritis, advised for a knee replacement surgery or something like that. So whatever is the disease, we will be focusing on the body of the patient, and we will be doing detailed investigations and to find out what are the problems, what all systems are affected. It's only the psoriasis, it's only the skin is affected, or there is affection of the joint is there, or there is associated comorbidities like diabetes, hypertension. The patient may not be aware of it. Many of the patients, they are only after when we are looking into the detailed blood test and all, they'll be aware of the liver problem or the kidney problem or the starting of the not really starting. They may be having a severe diabetes also. The HbA1c may be 10, or I had seen patients like that because they are taking steroids and they are unaware of the diabetes. It's already in a severe form actually. So all this, first thing is the finding out the problems and studying the body. Then even we will go learn to a detailed test about what our food is reacting to them, and then avoiding such things and give optimal nutrition, that is special food with the high omega-3. Omega-3 is the healing, so you need a high omega-3 food, but omega-3 you cannot just omega-3 alone will not be sufficient. Along with that omega-3, the omega-3 fat is a very fragile fat actually. You cannot take a lot of omega-3 high omega-3 seeds like flaxseed or other, some seeds are there, very super seeds. So if you take that is also harmful. So along with that, you should ensure that all the other antioxidants and vitamins like zinc, selenium, and B complex vitamin, and all that, it's not only one, it's all the associated nutrients also should be there. Then only it can balance the immune system and help you in the repair activities. Repair means the repair of the body, the skin has to be repaired, the damaged skin has to be replaced by the new cells. For that you need the nutrient, the building material should be there. That should be also in pure form, not with the additives like preservatives, coloring agents, tastemakers. So that you cannot take the tastemakers also. So that is the challenge. Without any of these items, you should get the optimal nutrition and also activities. The psoriatic patient with the arthritis and all will be finding it difficult with movements. So the gentle movements which can activate them, and that is just in a protocol. Actually, it is in a systematic way. We'll be following the patient, and also in the initial stage, every week we will be checking what is the inflammatory status, whether the CRP and ESR or the blood count, if it is high, whether it is coming down. Or I had seen patients with very low blood count because of the methotrexate they are taking, and the methotrexate they are if blood count is low, we'll try to reduce those medications faster. And whether the count is increasing also, blood count, it's seen very low blood count, but WBC count is very low. So when you are reducing the medicines like methotrexate and giving proper nutrition, the blood count also will come up. That is, so it should be more in the modern medicine. It is not only medicine; it should be evidence-based. If the lifestyle changes also, we cannot just say that it is giving effect. It is only not only the symptomatic relief you are following. It is each anti-inflammatory markers, and also we'll usually see AMA positive or anti-TPO positive also, even though they may not be having thyroid problems. So that also we have to consider, and we'll be following all this with the evidence-based medicine actually.
Actually, when these patients who are having other serious ailments come, then won't they be expecting that they should be treated as inpatients and they have to stay in the hospital or something like that? You always say that most of them actually should not be staying in the hospital for their lifestyle correction. How do patients understand that?
Yes, basically, for this lifestyle correction, if you are admitting and doing, when they are out from the hospital, the problems will come back. Because they are in a different, the food will be different, and the lifestyle pattern will be different. If it is in Kerala, I always encourage them to come to once in a week visit will be initially 3 visits should be in a weekly interval, or 3 or 4 3 visits will be sufficient weekly, and then every month, then bi-weekly, that after 2 weeks, and then a monthly visit will be enough. No admission is not needed, because we won't. I will the psoriatic patient or even the heart patients who are advised for a bypass surgery also we are taking, and none of this is an IP patient. It is they are living in their own home. That is always better. But if patients from overseas patient and all, we are asking them to stay at Cochin for 3 to 4 weeks. That will be usually enough, because depending on their problem, if they can stay more than definitely it is 90 days stay, it is all good. But usually 30 days, 2 to 4 weeks stay will be sufficient for most of the diseases. And many of them will be working at the present condition. Even if they are not working, they may not be able to stay away from home because there will be so many responsibilities. And you're teaching the patients to stay at home and doing the things, and we are following it up over the with the digital follow-up. Now the technology is very efficient, no? So even the food support, we give food support also, and nutritional support actually. So it can also be courier. It's all courier, flight couriers are available, and they can get it within 2-3 days. And so that way it can easily manage. Only thing, if an overseas patient or from the US or the UK, I am treating this overseas patient also. So they had to come down to Cochin for at least, if they are overseas, it is always better 3 to 4 weeks, depending on their severity of the disease, they had to be there. Or if for that actually, distant patients, we ask for a telemedicine consultation, and they can send out their reports, or we can talk over depending on their problems, and see their reports, and then we can tell you, I can tell you what is the you can expect also, what is the situation depending on the situation. You can, what is the expectation you can, and so if they're staying, they're coming in, my Malayalis, that is my Keralite people, who are coming from the US and the UK and all for the treatment, they'll be having so many engagements, and every day they'll be having that sort of things is not possible. Or then you think that then you can see for the sightseeing, some sort of sightseeing, and or the other nationals, they can some sort of this thing. But if you are fully concentrating on this as a tourist, to see the visiting the places, it may not be possible. But you get concentrate on the treatment itself, and have some other entertainment also. That way, it will be very effectively. You can come out of almost all that, because I'm around Indians and the Malayalis are all over the world, and they are also coming for the treatment. I know, because of that, I know what all the treatments are available and what is the treatment situation in different, almost all the major countries, and they are able to come most of. If you are staying on a month, or it depends on the situation, they can come out of almost all the medications. They may be taking medication for the diabetes and hypertension along with the psoriasis problem or the arthritis problem for many years, and they can come out of and make sure that with the reports itself, see that the this psoriasis symptoms itself, the flakes and the itching is gone, and the appearance show that. And internally, you can see the inflammatory markers, and other metabolic disorders are there, hypertension, diabetes, everything you can check and see, and it is basically, it is evidence-based. Evidence should be there. And the patient, because we are doing this test every week to give the confidence to the patient also. And I also have this, if the patient is doing like this will be the result. And if the result is not there, what is the problem? We are finding out also that there may be something patient is not able to understand. That is maybe creating the problem.
Finally, if we want every psoriatic patient to know something that he can start off today, that is some habits starting from today that will start to help in his treatment and overcoming his problem. What are those things that you would suggest?
Basically, one thing the patient has to do is to do at least half an hour to 1 hour light exercise at least, and correct your sleeping pattern, and do exercise, correct the sleeping pattern, and avoid this food with the color and preservatives, and adjust to minimum number of food. You eat the food, but not from all sort of things, and minimize the ingredients in the food. Then only you will be able to find out which is comfortable for you and which is reactive for you. If self-modulation or self-lifestyle correction, that should be the only way out. But the support, and also see that you are taking a balanced diet and high omega-3 and all the nutrients is there. So I can't say a simple solution for that. That is why I'm giving actually nutrition food also, supportive food also we are giving to make sure that the person is getting all the nutrient in the correct proportion. And also the exercise also, what we are teaching them is to activate all the muscles There are around 650 muscles in our body, and all the 650 muscles, and also then the final point in the meditative, that relaxing your brain and activating your brain and different parts of the body. That is done in a systematic way, actually. So that has to be learned. That is why I can't treat in digitally or remotely. I won't be able to teach these things. The ideal things, if you had to be taught exactly, then you had to go through this process of this protocol and learn it and then practice it, and then it is possible to support you remotely. That is possible, but teaching is from the beginning. It is not possible, cannot be done remotely. And the simple way you leave this correcting the stress reducing and all, as I said, you can practice at home.
Dr. Jodi, what exactly is lifestyle correction when clinically supported, as compared with saying eat better or exercise better or do so many things that you can better?
The difference between the clinically supported lifestyle correction and the regular lifestyle correction. In conventional lifestyle correction means the people with our own understanding or one's own understanding, they are trying to correct it. And everyone knows that if some exercise is needed, they'll go to a gym or go for swimming. And for the food habits changing, they'll approach a lifestyle, approach usually a dietitian. And in many of the hospitals, there'll be a dietitian, but and also if the problems are severe, they will be going for a physiotherapist for specialized exercises also. So that is the usual now. In clinically supported lifestyle correction, what I am following, in that we initially itself we try to understand the health status of the patient and the disease status of the patient, not only from the symptomatic and also from the investigation point of view. The disease, the psoriasis is there. Psoriasis is now we are discussing on the psoriasis. When we think of psoriasis is not just a skin disease for me. Basically, it is an autoimmune disease. Your immune system is under stress. So it can, this immune system, one immune system is all over the body. It is the immune system. It is functioning in the brain and every part of the body. At a cellular level, it is functioning. So we had to find out the reason for the stress of the immune system. And the psoriatic patients will not be having the psoriasis alone. Other problem, there will be anxiety, stress, usually overweight, obesity. Or if it is a long-term medication, they may be having diabetes, hypertension, depends on if it is after the older age diabetes, hypertension, all these metabolic problems also will be there. So we'll be first assessing what is the current condition of the body, the inflammatory status, and also the body composition. What is the body composition? Generally, as medically talk is lean mass fat mass ratio. The fat is very, very important in this. This fat, actually, the maximum amount of fat, it should be around 15 to 25. 15% in the ideally it should be 15% for the male and the 25% for the female. But for most of the disease patients, the fat level will be very high. And the type of fat which is in the body and also in our food. If you are eating so much of omega-6 fat or the trans fat or this hydrogenated fat, the inflammation level will go high. So if the excess fat is, that also it's very important, and to reduce those, that is all considered as toxins. Body itself is considering them as the toxins, so it has to be get rid of from our body. And in that way, we will be following it up with the inflammatory markers, the ASR, CRP, HSCRP, and other diseases if anything is there, or any autoimmune antibodies are increased. So we are following it up with the correcting the lifestyle in a systematic and way. The optimal, basically the simple mechanism of the correction, what is needed for a lifestyle correction is one is the nutrition should be optimal nutrition, then is optimal exercise. The exercise in the correct way, not too, both this should not be too little or too excess. That is the most important. Next is the toxins. Reduce the toxin intake through the food and the air and water. You have to try to reduce. This PET bottles, if it is kept in the sun, and it will be having so much of toxins. Everyone knows it. And also, nowadays we are taking the food, which is instant delivery system. They are all packing the hot food in the plastic containers. So many toxins, extra toxins. And also, when you are taking food from outside, so much of color, preservatives, and the sauce, all these sauces are all mixed with so many of the flavoring and coloring agents. So all these toxins you are taking into your body. So you have to reduce that. You have to cut off this food additives. Eat fresh food. Even this processed food means this processing is if it is reducing the nutrition and also the adding this preservatives. So such things has to be avoided. And giving a protocol for with a simple protocol for those things, if you are able to follow, and all these things, the correct nutrition, this thing, and also the mental and physical rest, enough sleep. If all these parameters are corrected, then it will be very easy. That is the difference between, and it is in a scientific and systematic and evidence-based way. Then that is actually clinically supported lifestyle correction.
From what I heard, what we understand is general lifestyle correction means what someone is able to do on one's own with one's own knowledge and all that. But clinically supported lifestyle correction means you're actually making your food, your activity, your sleep, you're making each of these actually act like medicine for your disorder. So that is the sharp focus of this approach. Actually, when you are looking at patients who are suffering from psoriasis, some of them may be at the beginning stage, some of them must be suffering for long and having all sorts of other complications and comorbidities and all that. Which are the patients can you think of that who benefit most from this clinically supported lifestyle correction?
See, everyone, if they are willing for a lifestyle correction, they will be getting benefit. Even a beginner, if you are not gone for so many medications like methotrexate, because that is actually harming your body. Many of these immunosuppressants, and in long term, if you are taking steroids for a long time, you will be having associated diseases also. Basically, the most benefited will be the most suffering. Too many diseases are there. Actually, if psoriasis alone is there, definitely psoriasis can be easily overcome. But the others who are suffering it for a long time and taking medication and associated comorbidities like diabetes, hypertension, etc., also is part of it. They are also much more benefiting, because we are always thinking in terms of this commercial activity, this sort of thing. So they'll be getting 3 diseases are there, like diabetes, hypertension, and psoriasis. They're getting out of this all the 3 diseases. That is the advantage of this lifestyle correction. We are not the sun is giving light to everyone. So if you're sitting in the home, you won't get it. But if you're going out and getting fresh light, that is, you are getting it. So just like that, when you are giving the clinically supported lifestyle correction, you are giving nutrition for all your cells. At the cellular level, we are trying to give it. That is why it is called a cell activation protocol. And you are giving stimulation for all the cells in the trying to give stimulating all the cells in our body, and also to remove all toxins from your body and preventing the more toxins to come inside. So the benefit will be to all the cells in the body. And giving rest. Actually, the immune system is actually actively functioning during the sleep and the rest time, especially during the sleep. So proper sleep, all the cells in your body, not only the skin is getting benefit, all the cells in your body is getting benefited. So that is the value of this clinically supported lifestyle correction. You are understanding. Actually, it is not a more than a treatment, it is a teaching course. You are, with the support, you are trying to understand. With the professional expertise and the support, you are learning how to manage your body in a most efficient way. Which food is most efficient for you, how much you can eat, how much is excess for you. It also will be different for you. We are all thinking that this general teaching in the medical science also, you need an average medium activity, 2,500 or 2,000 calories per day, and such things are there. But it is not really functioning. With my experience, I'm telling, some people doesn't need much of the calorie at all. So that is why they are even the same, two people eating the same, but one will be keeping lean, but the other is getting over obesity is with them. That is depends on your metabolism also. It depends on your cellular metabolism, even the mitochondria. That is that is actually the powerhouse of your body. That also is very different in different people. So you have to learn that and adjust according to your body specification. Then you can, that is actually teaching you how to, and by following with the test and all. It's basically everything in the modern medicine should be evidence based. So we are actually following it with the even day-to-day follow-up over the digitally, and initially in the weekly follow-up at the and the testing, and then monthly, and even from the different distant overseas patient or distant country, also we will be able to follow in the correct manner, and they are also able to manage and get out of this lifestyle diseases and out of medication also. That is the most important. If you are taking medicine, then you are a sick patient, even though you are controlling. And many patients, there is psoriatic patients. Doctor, I am having this diabetes and hypertension and cholesterol and all that. I'm not bothered about that. It is okay with my medicine. I can take that medicine, but I want the psoriasis to go. My skin has to problem, which is so much itching and discomfort. So you cannot treat psoriasis alone. You have to treat the diabetes and hypertension also along with that. So diabetes, blood sugar control, we can, if it is correctly following the instructions within 24 hours to 48 hours, you can get the blood sugar control without any medication if it is a type 2 diabetes. So excess glucose is also a toxin. So we have to come out of all these toxins, toxic exposure to be reduced.
Actually, when we are talking about treatment of psoriasis, many a time, the feeling is, if I can do something that will make an immediate visible improvement, there is nothing better than that. So the general feeling is there may be medications which may be able to give an immediate difference. But regarding clinically supported lifestyle correction, what are the possibilities of getting quick relief?
For the quick relief, for the psoriasis patient, immunosuppression is the best way of doing it. Basically, say the modern medicine, anti-inflammatory agent and immunosuppressants are very effective for immediate result. For the lifestyle correction also, the result is very fast actually. But if the patient is symptomatic, like a pain or this exfoliation, etc., itching and all, we give light immunosuppressant like dexamethasone or some local applicant steroids for the initial few days. And also, if the psoriatic arthritis is there, NSAID group of medication also can be used. And what we do is actually stay for the same symptomatic relief, give medicine, and then within a week or so, that immune system will start acting. Actually, the most beautiful thing in the immune system is this immune system cells have a lifespan only for 4 or 5 days, and if it's a diseased condition, it is maximum 7 days, and in diseased condition only 3 or 4 days. And when you give optimal nutrition and the toxins are reduced, the immune system will get corrected and the repair activities will get corrected, and most of the patients will get a relief within a week. Then you can taper off the medicines. But if I am giving some anti-inflammatory, actually all of the medicines in the modern medicine which is used is anti-inflammatory. The steroids and all the medicines actually, and the painkillers and the fever reducing agents and everything is actually anti-inflammatory medicines. And then we are tapering off that medicine. And also if the patient is taking other medication from the older prescriptions, maybe for a long time there will be medicines. So that also will be tapered off gradually with the showing with the monitoring the symptomatic relief. And also for the skin psoriasis, we can see the evidently on the skin, and also follow with the anti-inflammatory markers in the blood also. Now, another important thing is if the patient is having this diabetes, and patient may be on insulin and some other anti-diabetic medicines also. That in the type 2 diabetes, we stop the diabetic medicine at the first day itself. And the patient is following correctly within 24 to 48 hours, the blood sugar will be within control also. So you are eliminating that toxins also. That is, the medication is also the body for the immune system, that also is overburdened. So that also is getting reduced. So it depends on the patient's condition. Within 1 to 3 months, we will be able to get out of all the medicines. Even those on high this methotrexate and all. Methotrexate also will be, so if it is 20 milligram, initially we reduced every weekly. If the symptoms is okay, we reduce to 15 milligram, 10 milligram, then 7.5, 5 grams. And likewise, we reduce the gradually withdrawing. Only the diabetic medicine for the type 2 diabetes, immediate tapering off. Because we can see the blood sugar within 2 hours itself, we can see the result. So everything is what is the clinically supported lifestyle correction, the evidence-based, and the symptomatic and the blood report, and everything is following in the most efficient way. We are using all the modern medical amenities in the most efficient way. Even if you want a symptomatic relief medication, also we use it, then gradually withdraw it.
Actually, can you give an example of a case where this clinically supported lifestyle correction has made a remarkable improvement in a psoriatic patient in a very short time, surprising the patient himself?
Actually, each patient is a surprise for me and also most of the patients also, because after seeing, maybe this sort of videos seeing, then they are coming to me. And they, especially when in the social media, they will not be believing it in that exactly. But then maybe, anyway, I'm suffering a lot and trying all these measures. And this may be giving me a result. That maybe most of the patients will be thinking like that also. Because wherever you look, in the this medical literature and all, this sort of thing is not anywhere. So when we see, I have also seen many patients who are very severely affected psoriasis, severe affected. Even all this yellowish, this pustular psoriasis is the most difficult actually, and this pustular psoriasis, and the itching, heavily itching, and along with that other diseases also. Blood sugar control is not there, and there may be, and the sleep is not affected, and the husband may be complaining of I'll tell you an example. Actually, this patient, she's suffering from psoriasis for a long time, and she is diabetic, and actually she has a corneal ulceration also. She's under the care of an ophthalmologist for the ophthalmology consultation. Actually, she's gone to a very famous ophthalmology center for this eye problem, and she's taking treatment for this arthritis, psoriatic arthritis also is there, and the rheumatology care is there. And finally, the rheumatologist has advised her to take she's on methotrexate and the insulin, daily dose of insulin. I don't remember what all medicines, and diabetes, hypertension, everything is there actually. And the rheumatologist has asked for this rituximab, some monoclonal antibodies, which is costing around 50,000 rupees in Indian value, 50,000 rupees for a single injection, and she may be needing weekly or monthly injection, initially weekly and then monthly injection or something she has was advised. And in that stage, she is coming to me. And when we start this treatment, actually it is the calorie, it's what we are support nutrient food is a low calorie. This the carbohydrate and also the saturated fat is very low. The omega-3 and all the nutrients and the dietary fiber and all will be in the optimal value, it will be there. So with that food, within a day, her diabetes, insulin stopped in the first day itself, diabetes is controlled, and the symptomatic relief is there, painkillers and all. Initially, if I don't remember exactly whether she was on painkillers, but if the pain is there, we'll give light painkillers. Within a month, she was able to come out of all the medications actually. Except she was using the steroid dose for her corneal ulcer. Actually, she was advised for a corneal, if she has to, it's almost gone that vision. And when looking also, this opacity was there very visually, and some sediments you can see there's some level of sediments inside the eye also. So I also told her, I don't know whether in your vision, and at least when you come out of all these problems and diabetes and everything is over, you can think of a corneal transplant. Otherwise, in this stage with the diabetes and this active status, if you go for a corneal transplant also, it may not be successful. So, and actually within 3 months, her this eye drops, that initial all the oral medicines and the diabetic medicines, everything is over, and the the psoriatic problem, arthritis, everything is over within a month itself. But she was continuing. I was not confident to stop this steroid drops. Then we gradually reduced the number of steroid drops from the in the eye, and her vision also is completely recovered. And there is only some little opacity in the outer part of that initially that the cornea was actually this edematous and opacity was there, but only the outer part there is some scarring was there. Otherwise, her vision was also restored. So that is actually, I never thought that that will be possible, but restoring her vision, I was never hopeful about. But that also was possible. Otherwise, the diabetes and hypertension and psoriasis, it's so many patients we are seeing and getting result. But this corneal ulceration and uveitis, it's not only corneal ulceration, uveitis also was there. That is why there is pustles inside, that there is a level of sediments inside. That also cleared. That is actually very satisfying. And it is very surprise for me also.
That example was incredibly powerful and definitely satisfying to you. In this episode, we have been seeing how clinically supported lifestyle correction can make changes in the lives of psoriatic patients. From what Dr. Jolie often says, from being a passive patient to becoming an active healer is what every patient should hope for. So that is, I think, in a way illustrated in the talk of this 4-part episode on psoriasis. Thank you all for being with us in this 4-part series on psoriasis, and welcome to more videos on lifestyle disease doctor. Thank you.